This video is for educational purposes only and not intended as medical advice or graphic entertainment. Have you ever looked in the mirror and thought, wait, when did that fine line get there? Or maybe you've noticed your skin just isn't bouncing back the way it used to after a long night out if you're in your 30s, or getting close. Listen carefully, this decade is absolutely critical for your skin's future. What you do now will literally determine how you look in your 40s, 50s, and beyond. Today, I'm going to walk you through the most essential research-backed dermatologist-approved anti-aging strategy, and I'm not holding anything back. Hi, I'm Dr. Pourpop, a board-certified dermatologist and the founder of Ramen Aesthetics. Over the past 18 years, I've helped thousands of people transform their skin at every stage of life, from teenagers fighting acne to celebrities in their 50s who want to age like fine wine. And if there's one thing I know for sure, it's this: your 30s are the golden hour of skin health. But the problem is, most people wait until the signs of aging show up before they start taking it seriously. By that time, the damage is already done. So whether you're 31 or 39, this guide is for you. Let's dive into the 10 things you must do in your 30s to look radiant and youthful in your 40s and 50s. Section 1. Collagen, your skin's best friend. Let's start with the foundation of youthful skin: collagen. You lose about 1% of your collagen every year starting at 25. That means by your mid-30s, you've lost up to 10% or more, and the effects start to become visible: fine lines, sagging, dull texture. Collagen is what gives your skin its bounce, thickness, and elasticity. Think of it like the springs in a mattress. Without it, everything sinks and flattens. So what can you do? 2 things: preserve what you have, stimulate your skin to make more. We'll cover how to do both throughout this video, but know this: you have more control over this than you think. Section 2. Sunscreen is still your number one weapon. Yes, I'm starting here again. I will never stop repeating this. The sun is the number one cause of premature aging. Studies have shown that up to 90% of visible aging, like wrinkles, dark spots, and sagging, is caused by UV exposure. In your 30s, you may start to see the early signs of sun damage accumulated in your teens and 20s, especially if you spent summers tanning or forgot SPF on cloudy days. So what's the fix? Use a broad-spectrum SPF 30 or higher every single day. Reapply every 2 to 3 hours. When outdoors, choose physical sunscreens with zinc oxide or titanium dioxide. Wear sunglasses, hats, and seek shade when possible. My patients in their 60s who started sunscreen in their 30s, their skin looks 20 years younger. Section 3. Cut back on lifestyle collagen killers. You already know what I'm about to say. Don't use smoking, alcohol, poor sleep, processed sugar. These are all collagen assassins. Smoking decreases blood flow and increases enzymes that break down collagen. Alcohol dehydrates the skin and impairs vitamin A absorption, crucial for cell turnover. Sugar triggers glycation, a process that stiffens collagen and makes skin lose elasticity, and chronic stress, it increases cortisol, which breaks down collagen even faster. This doesn't mean you can't enjoy life, but be mindful. Moderate your habits now, and your future skin will thank you. Section 4. Upgrade your skincare routine. Your 20s were for experimenting, your 30s are for consistency. Here's the core 5-step routine that every 30 some should follow. Cleanser, gentle pH balanced, non-stripping antioxidant serum AM like vitamin C2. Protect from pollution, and UV moisturizer with ingredients like ceramides or squalane. SPF AM, always, no exceptions. Retinoid PM, retinol, or prescription tretinoin to increase collagen production and reduce fine lines. Retinoids are your powerhouse anti-aging ingredient, but start slow. 2 to 3 times a week with a low concentration. Pair it with moisturizer to reduce irritation. Section 5. Add activives that work. Now let's talk ingredients that work at the cellular level. In your 30s, your skin is mature enough to handle retinol or tretinoin. Boosts collagen, unclogs pores. Niacinamide brightens, reduces redness, improves elasticity. Peptides signal the skin to produce more collagen. Hyaluronic acid plumps and hydrates growth factors, repair and rejuvenate skin cells. Make sure you're not using everything at once. Start simple, layer one at a time, and build your routine. Section 6. Know when treatments make sense. Here's where people get confused. Do I need Botox at 30? What about lasers? Here's my professional take. Preventive Botox is reasonable for people who have strong expression lines like 11s or crow's feet. Micro-needling can stimulate collagen naturally without downtime. Chemical peels can help with pigmentation or uneven texture. Laser treatments like Clear Plus Brilliant can gently resurface and stimulate, but remember, you don't need all of them. Focus on maintenance, not overcorrection. Section 7. Beauty from the inside out. You can spend $500 on a serum, but if your diet is full of processed foods, you're wasting your time. Eat foods rich in vitamin C, zinc, omega-3s, and antioxidants. Hydrate your skin cells. Are 70% water. Consider collagen supplements, marine-based peptides, and hyaluronic acid boosters. But always consult your doctor. Bonus, regular exercise improves circulation and helps detoxify the skin. Section 8 Mindset plus sleep equals youth. Yes, even your mindset affects your skin. Chronic stress ages your skin. Poor sleep reduces skin barrier repair. Negative self-talk increases cortisol, which breaks down collagen. Get 7 to 9 hours of sleep. Practice meditation, breath work, or simply take a walk without your phone. Inner peace equals outer glow. Section 9 The 3 S's Skin structure support. As a facial specialist, I look at 3 layers of aging skin: texture, tone, pigmentation. Structure, bone, fat, pads, muscle tone, support, lymphatic health, hydration. Fascia. Your 30s are the time to preserve all 3. Gentle facial massages, facial yoga, and lymphatic drainage help support the faces. Natural lift. Section 10 Final words. Your skin's future is in your hands. 1430 to 600 Look, you don't need to do everything at once, but you do need to do something. If I could go back and tell my 30-year-old self anything, it would be wear SPF, start retinoids.